Over the years, the Belize Family Life Association has been providing services to Belizeans, including men, women, and youth, on healthy lifestyle practices, the importance of getting general checkups, and visiting regularly with healthcare professionals.
Come in and do your checkup. We have a range of services from your prostate exam. We do testicular checks. Check on your regular, just the normal weight, pressure, and sugar, and so right. Because as you know, there are a lot of obese people walking around. We take for granted that we are okay, and then suddenly you have an issue where someone falls, lands in the hospital, and then that's it.
BFLA recently acquired a new pathologist and has expanded its cytologist services, which tests for cervical cancer and other ailments. While the service is not free, the prices and packages are competitive. Marketing Officer Charmaine Garcia says that the quality of service is top-notch.
One of those services is the anal cytology. What that is, it tests for cancer. Just like how we do the pap smear, and that tests for cervical cancer, or we do the breast exam to check that there's no lumps or so on, we have one for the anal. Now, as long as you're having sex in the anus, then you are at risk, whether it's a male or a female. So we now offer that service. We also offer, and with that, it's just to detect if there's any cancer or any precancerous conditions or such, right? We also offer services, lab services, such as the breast smear. If a woman is secreting from the breast, we can now test that as well. We do the brushing and so, and these are terms more for the physician, the specialist. They can now take their samples and send it to us here at BFLA, and we can give them back their results.
Genital warts affect both men and women and is a sexually transmitted infection that is easily contracted if there is contact with an infected person. Dr. Natalie Bruce over at the BFLA NHI clinic in Belize City says that while there is medication and other options for treatment of genital warts, Garcia says seek medical advice.
The genital wart spreads. If you have some abnormal lesion or something that looks like a wart on your genitals, please come in. We can do the testing, and we can also assist in the treatment. Depending on the person's immune system, depending on a lot of stuff, how rapid these warts would grow.
And there's a cure for this?
There is a treatment. It is said that once it's in your bloodstream, that it doesn't go away. So the chances of, even if you treat it, chances of it recurring is possible.
HPV leads to genital warts, but is also a risk factor for cervical cancer. So if you detect that you have symptoms similar to that of genital warts, get your pap smears and HPV tests. Women 25 years and older are encouraged to get screened early because prevention is better than cure. HIV-positive patients, as well as women with a history of cancer in their family, are at higher risk and should do pap smears on a yearly basis.
We obtain sample from the cervix of the patient. So the patient will come in. You have to make sure that 3 days prior to the procedure, they haven't had any sexual intercourse, hadn't been using any type of medication in the vaginal area, for example, the ovules, and so forth. The patient will come in, we put them in a lying position in the stirrups, we insert the speculum, and swab is taken using a cervical brush, and that is placed on a microscope and it's fixated. That is later sent off to the cytologist, who does evaluation by observing the cells under the microscope and giving a diagnosis.
A fee of $2 is charged for patients under the National Health Insurance. Otherwise, they would pay $65 per test. Duane, Moody for News 5.